Hello, my name is Maria Preciado, and I am going to be presenting the comparison of the healthcare system between Canada and the United States. With this presentation, I hope you get an overview of a system that is known for its unique government-funded system and how it compares to ours. First, we're going to take a look at the United States healthcare system. In the United States, there is no central agency or no control of availability and utilization of services. The United States is a country that doesn't have a central agency that monitors total expenditures through global budget or controls the availability and utilization of services. In the US, private insurance providers are allowed to determine how much a person will pay and how much access they will have. Although the government does offer free public health assistance to those in need, citizens must meet certain criteria to receive the services. Health insurance in the U.S. is purchased in the private marketplace or provided by the government to those who qualify. Private health insurance is employment-based, but workers are not mandated to buy it. Private insurance includes many different types of health plan providers. Those who do decide to get insurance through their employers most likely will be paying a share of the cost of premiums through payroll deductions. Furthermore, they would also have deductibles to meet before any benefits are payable by the plan. In addition, consumers would also have co-payments, which is a flat amount the insured must pay each time health services are received. The U.S. healthcare system is an imperfect market managed by MCOs, which are HMOs and PPOs, also third-party insurers and power balancing. In our book, it states that medical care and its benefits are distributed based on people's willingness and ability to pay, and this is how most goods and services are distributed in a free market. In other words, it's very difficult to get the services and quality of healthcare you need at a price you can afford. Price is set by price makers rather than by supply and demand, giving power to the insurance providers and allowing them to give you the access and prices they want. In the United States, physicians can balance bill, which means out-of-pocket costs to consumers. Providers are allowed to bill the consumer for the difference between the provider's charge and the allowed amount. For government-funded programs, Medicare varies from state to state in terms of eligibility and benefits, but Medicare allowed physicians to balance bill the patient the amount above the program set fees and recoup the difference. On the contrary, Medicaid, because it provided coverage for certain economically disadvantaged groups, it prohibited balanced billing and limited participation from physicians. For out-of-pocket costs, Medicare requires deductibles for hospital stays and ambulatory care and co-payments for physician visits and other services, while Medicaid requires minimal cost sharing. Most private health insurance have co-payments and deductibles to meet before the benefits start to kick in. Health spending in the United States is $11,916 per person, with a 16.9% gross domestic product, 49% public, and 51% private. Now we're going to take a look at Canada's healthcare system. Canada's healthcare system is a single-payer system, which means equal access to all their citizens. Canada implemented a national health insurance system referred to as Medicare. Medicare is a government-run health insurance system covering the entire population with medical benefits package. Health insurance coverage is universal, which means general taxes finance the health insurance system through a single-payer system. The federal government provides healthcare funding to the provinces and territories through the Canada Health Transfer. Cost control is contained through fixed global budgets. fixed payment amount is allocated to a provider to cover operating expenses for usually 1 year. The annual global budget is negotiated between the ministry and each individual hospital. Capital expenditures must also be approved by the ministry, which funds the bulk of the spending. The government's role in healthcare is setting and administering national principles for the system under the Canada Health Act, financial support to the province and territories, funding and/or delivery of primary and supplementary services to certain groups, provides equalization payments to less prosperous province and territorial financing to the territories. Government is also responsible for health protection and regulation. So regulation of pharmaceuticals, food and medical devices, consumer safety and disease surveillance and prevention. Government also provides support for health promotion and health research. In addition, the federal government also provides tax support by giving tax credits for disability, medical expenses, caregivers, and disabled dependents. It also gives tax rebates to public institutions for health services, deductions for private health insurance premiums. The province and territories administer and deliver most of Canada's healthcare services. The role of the provincial and territorial governments are administration of their health insurance plans, planning and funding of care in hospitals and other health facilities, services provided by doctors and other health professionals, planning and implementation of health promotion and public health, negotiation of fees, schedules with health professionals. The universal health system has the Canada Health Act, which is affordable to society, freedom to choose their own doctors. The Canada Health Act is a publicly funded health insurance that gives all their citizens access to healthcare insurance without any barriers. The Canada Health Act was passed in 1984. Under the Act, each provincial health plan is administered at the provincial level and provides comprehensive first dollar coverage for all medically necessary services, with minor exceptions. Health coverage is available to all residents with no out-of-pocket charges. This allows all citizens to have the same access and quality of care. Coverage is not dependent on income or tied to their job. Whether you are rich or poor, everyone is in the same system and have the same equal access. The program consists of 13 provincial and territorial healthcare system and insurance plans. With that said, there are some services and treatments not publicly covered, such as dental care, chiropractic services, massage and physical therapy, routine vision care, mental health, home care, and pharmaceuticals. Most Canadians have supplemental health private insurance for uncovered services. Now, if there is a certain needed treatment and is not covered through the Act, it states on their webpage, it is up to the provincial and territorial health insurance plan, in consultation with the respective physician colleagues or groups, to determine which services are medically necessary for health insurance purposes. If it is determined that a service is medically necessary, the full cost of the service must be covered by the public health insurance plan to be in compliance with the Act. If a service is not considered to be medically required, the province or territory need not cover it through its health insurance plan. So in other words, they have the last word. They decide whether something is covered or it's not. Anything, I believe, in specialty care. The right for extra billing or balance billing was removed in all provinces, so no out-of-pocket costs to the citizens. With the passage of the Canada Health Act of 1984, the right to extra billing was removed in all provinces. Practitioners are not allowed to be paid extra billing. There are mandatory penalty provisions under the Act, and if they determine that a physician was extra billing, whatever the amount that was extra billed, the province or territory will reduce their federal cash contributions by that amount. There is no cost sharing for publicly insured physicians, diagnostic and hospital services. User fees for ambulance services vary considerably across provinces. All prescription drugs provided in hospitals are covered publicly, without outpatient coverage varying from province or territory. Physicians are not allowed to charge patients prices above the negotiated fee schedule. The monetary exchange is practically non-existent between patient and healthcare provider. Health spending in Canada is $5,782 per person, 10.4% of gross domestic product, 70% public, and 30% private. Now we're going to take a look at the similarities in healthcare system between Canada and the United States. First, their undocumented immigrants are generally ineligible for any public coverage. So temporary legal visitors, undocumented immigrants who stay in the country beyond the duration of a legal permit, and those who enter the country illegally are not covered by any federal program. Next, both are aiming to reduce disparities in healthcare. They both have public financed healthcare available to their citizens. Although they're a little bit different, they both do offer public finance healthcare. There are some safety nets for those with disabilities and the elderly. Both healthcare systems have gatekeeping. In other words, they still have physicians limiting the access to specialty. So the gatekeepers are the physicians who have the last say whether a patient goes to see a specialist or not. So they would need referrals. They're the gatekeepers that keep patients from moving on to any specialists. Now we're going to take a look at the insurance system and payment system for each country. In the United States, they have third-party payers, insurance companies, MCOs, Blue Cross, Blue Shield, and government health insurance. So for private health insurance, it is purchased in the private marketplace. Private health insurance can be purchased from various for-profit commercial insurance companies or from non-profit insurance. About 84% of the population is covered by either public or private. It can be purchased by individuals or shared by employers and workers on an employer-based specific basis. Approximately 61% of health insurance coverage is employment related, largely due to cost savings associated with group plans that can be purchased through an employer. Most are managed care health insurance plans. There are basically two types of MCOs, which are HMOs, health maintenance organizations, and PPOs, which are preferred provider organizations. HMOs are prepaid and in return provide complete services and enrollees. PPO are third-party payer that offer incentives such as low out-of-pocket prices to enrollees who acquire medical care from a preset list of physicians and hospitals. Private health insurers typically negotiate payment rates with providers. Now, government or public insurance, which is nearly 26% of the U.S. population, is covered by public health insurance. There are two major types of public health insurance, which is Medicare and Medicaid. Medicare is a public health insurance program for aged and disabled. Medicare is the largest health insurer in the country and covers about 13% of the population. Medicare consists of two parts, which is a Part A and a Part B. Part A covers inpatient hospital care and some very limited nursing home services and some home health. Part B is voluntary or supplemental and provides benefits for physician services, outpatient hospital services, outpatient laboratory and radiology services, and home health services. Part A is funded by a Medicare tax, and Part B is financed by monthly premiums and general taxes. Medicaid is jointly financed by the federal and state government and is administered by each state. Coverage under Medicaid varies because states have established different requirements for eligibility. So how do physicians get paid? So fee-for-service is the most common way. Prepaid health plans. Physicians who service under Medicare are also reimbursed on a fee-for-service basis, but the fee is fixed by the government. Medicare payment rates are typically determined according to a fee schedule. Medicaid rates vary by state. Under both Medicare and Medicaid, the physician can choose to accept assignments of patients. If the physician accepts the assignment, he or she agrees to accept the government-determined fee in full and cannot charge the patient an additional amount beyond the normal 20% copayment. The physician must also agree to treat all Medicare patients for all services. Now let's take a look at Canada. Canada, the provinces are government funded, which means general taxes financed. The provinces and territories administer their own universal health insurance programs. When a citizen needs health care, their point of care is usually the primary care physician. They will seek treatment for common disease and injury. Patients who require further diagnosis or treatment are referred to other healthcare services by their primary care physician. If needed, a patient may be referred to a hospital, long-term care facility, or community. The majority of specialist care is provided in hospitals. Long-term care and end-of-life care provided in non-hospital facilities and in community are not considered insured services under the Canada Health Act. Mental health care has not been formally integrated into primary care. So there is a universal coverage for physicians that provide mental health care, but not in a specialty psychiatric hospital. Psychologists may work privately, but that would have to be out of pocket. Specialists are mostly self-employed and paid fee for service. The province and territory provide additional supplementary services to seniors, children, and low-income residents. They often also include prescription drugs, dental care, vision care, medical equipment, and appliances such as wheelchairs and prostheses, and services of physiotherapists. Patients have free choice of primary care doctors. With the additional supplementary services, there are some health services that are not covered under the publicly funded healthcare system, so the province and territories provide these services to certain people, such as low-income residents, children, seniors. Those who do not qualify for the supplementary service pay for these services out of pocket. There is also private insurance. So private insurance is used to cover services excluded from public reimbursement. Many Canadians are either through their employer or on their own covered by private insurance, and the level of coverage provided varies. Private insurance may be used to cover services such as vision, dental care, prescription drugs, rehab services, and home care. So these are services that the public reimbursement doesn't offer, so they can use their private health insurance to offset the cost of these services. In my opinion, I feel that Canada's healthcare system meets the needs of all their citizens. Through their insurance, they can access basic health insurance at an affordable cost with no out-of-pocket cost. Furthermore, they can access any additional services not covered through their program by getting additional supplementary services. As I did my research, I did learn about some disadvantages, such as longer wait times to see a doctor or to get tests done, or how citizens might not be careful and overuse their insurance. Nevertheless, they all have universal health care, which allows everyone to have basic access at an affordable price with the same quality of care as everyone across the board with no barriers.